our job here is to repair those relationships so that even though we're not going to be there with them every step of the way after they're done at Cathedral Home, we can sort of take solace in knowing that when they go back to their schools and their communities that they're using the resources that they had here to continue growing as human beings.
I think in my own personal work, something that I've been really impacted and touched by and just seeing the long-term impact is being able to work a lot with kids. And a lot of them are elementary aged, and it's just cool to see some of the narratives start to change in working with them and watch them learn some of the skills to know and understand when they need to reach out and ask for help and when they need a little bit of extra support, and then learn how to independently use those skills but know that it's okay to reach back out. It's not scary, it's something that's totally fine, which I really think is starting to change the narrative, which is really cool.
What's that phrase? It takes a village, right? And it does. Whether you have lots of money, no money, whether you have this wonderful supportive family at home, or whether it's kind of disjointed, we all need aunts and uncles and friends and teachers and support, and so Cathedral Home is a critical part of that. So.
My career was special education, some of it kids with special needs, and realized, yeah, that Cathedral Home hit that too. Just my love for children that need a little extra help in life and a little more encouragement, and yeah, I think that was the right place to support.
I feel like I'm in a really privileged position as a youth and family advocate to get to see the alumni that have graduated Cathedral Home and have gone through their processes, and years later come back and say, this is how it helped me and this is how I'm helping people now.
I've had friends that have been on the board and told me what an incredible experience was, and I asked them why. Why is it an incredible experience? It's because you have no idea the difference you can make in the life of a child who's had a very hard life. And the outcomes through staff interaction, through compassion, through structure, and through education, it's just amazing the differences that I've seen from beginning to end in some of these kids. And it just makes you feel good to know you made a difference in a child's life.
Understanding that, a certain incident or certain behavior, whatever it is, doesn't define anyone. And there's usually a much larger component to that. And especially as an educator, it's not just about teaching out a curriculum, it's about helping them learn life sort of values and responsibilities and ways to, I don't know, I like to say trauma doesn't excuse certain behaviors, but it definitely informs it.
I am an advocate for children. I'm often an attorney for children in abuse cases, neglect cases, custody disputes, and I really feel like the Cathedral Home provides wonderful resources and opportunities for kids, and their community outreach and involvement has really been inspirational to me.
It's filling gaps that the town just doesn't have. They see a need and they fill it, and because waiting 4 months for help, that's why I like Cathedral Home.
It is so broad, and just the crisis center and the resource center and residential, all of us working in tandem and how well we collaborate with each other. It is one agency, and it's just, the impact is so huge. So to work for an organization that does so much is what facet can I help with now?
There is a need for a focus on mental health resources for adolescents, not just in Wyoming, but in general. And it feels like a privilege to be able to work in a place that really puts that at the forefront of our mindsets on how we operate every day.
So I think for me, why I really want to be part of this mission is just because I love the emphasis that Cathedral Home puts on advocacy and collaboration. So I've definitely noticed in my work just the power in being able to advocate and work with different people, whether that's a client needs resources, referring them to the resource center and working with them, working with the schools, working with other professionals, working to raise awareness to different important issues. I think that there's a huge emphasis placed on that allows for a very systemic and integrated approach to care that really meets each person where they're at and helps empower them to get them what they need to start their healing journey.